Welcome to Medicine Handy Point. Today we will discuss the nerve roots of lower limbs muscle group because it will help in identifying where the lesion is when we are doing lower limb neurological examination. So in hip flexion, the prime mover is iliopsoas muscle and the nerve root is L1 and L2. So if the patient has weakness in the hip flexion, so we will assume that there is problem at the nerve root L1 and L2 and the major problem is in iliopsoas muscle. So if in hip adduction, the prime mover are adductor muscles, which are adductor longus magnus. So, and then the nerve root is L2, L3, and L4. So, if the patient cannot adduct the hips, so there will be problem at this nerve root, and the muscle problem will be the adductor muscles. So, in knee extension, the prime mover is quadricep muscles and the nerve root is L3 and L4. So if the patient cannot extend the knee, so the problem is L3, L4 nerve root and the muscle are quadricep muscles. Dorsiflexion of the foot. Prime mover is tibialis anterior, external digitorum longus and external hallucis longus. Nerve root is L4 and L5. So if the patient cannot dorsiflex, means the patient has a foot drop, it means the problem is at this nerve root, which is L4 and L5, and these are the muscles which will be involved. If the patient cannot do the inversion of the foot, the prime mover for the inversion is tibialis anterior muscle and posterior, and the nerve root is L5 and S1. So, if the patient cannot invert the foot, the problem is at the nerve root L4 and L5, and the muscles are these tibialis anterior and posterior. Eversion of the foot. Prime mover is peroneus longus and brevis muscle, and the nerve root again is L5 and S1. So, inversion and eversion, nerve root are the same, but the muscles are different. So, if you can see, if you start from the hip flexion, hip adduction, extension, and dorsiflexion, inversion, and evergence, these are usually the lumbar nerve roots, except for the inversion and exversion, where S1 is involved. So you see, these are the nerve roots. So if the patient is lying, so if you are looking from the front, so hip flexion, hip extension, knee extension, dorsiflexion, and inversion and exversion are usually mediated by the lumbar nerve roots. So you can easily remember these nerve roots that from the front it is usually the lumbar nerve roots. No, so now let's move to the back side of the lower limb. So before we go there, one another thing, big toe extension, the prime mover is external hallucis longus and the nerve root is L5. So L5, if there is a problem with the toe extension, means dorsiflexion, there is problem with external hallucis longus muscle and the nerve root is L5. Now let's move to the back. Hip extension. The prime mover is gluteal muscle and the nerve root is L4 and L5. Hip abduction, prime mover is gluteal medius and minimus, sartorius and tensor fascial lata muscle, and the nerve root is L4, L5 and S1. Knee flexion, the prime movers are hamstring muscle and the nerve root is L5, S1 and S2. Plantar flexion, prime mover is gastrocnemius, plantaris, and soleus muscle, and the nerve root is S1 and S2. So if you see that here the lower lumbar nerve root starts and it goes to sacral nerve roots, as you can see if you observe the movements from the back movements, which are the hip extension, abduction, knee flexion, and uh, plantar flexion. It involves usually the sacral nerve roots. I hope I try my best to make the stuff simple and help you memorize the muscles which are important. So if you are doing lower limb examination of the patient with neurological deficit in lower limbs, you can easily identify the nerve root by checking the muscle power. So if hip extension is weak, so you will know that the gluteal muscles are involved and the nerve root is L4 and L5, so the lesion will be somewhere at L4 and L5. So you can easily detect the lesion over there by checking the power in individual muscle group of the lower limb. I hope you like the video and please subscribe to the channel.